About 50% of patients with Parkinson's disease will eventually develop psychotic phenomena. As the disease goes on, they're more likely to have psychosis. As cognitive impairment emerges, they're more likely to have psychosis. With medication treatment, they're more likely to have psychosis. So there's an ecology of things that come together to make it more likely for one patient to have psychotic phenomena than another. Most common hallucinations that one sees in Parkinson's disease are visual, particularly under circumstances of reduced stimuli. So just as a person is getting into bed, they might see someone standing beside the bed or standing beside the door. Or they might see just a kind of a moving shadow off to the side, something like that, something that can't quite be defined. So those are common visual hallucinations. In terms of delusions, most common thing is a delusion of infidelity, that your husband or wife is having an affair. And this is unlikely in an 85-year-old, and yet it's the kind of false belief that they endorse, that they cannot shake, that seems real to them in every way. And of course, it's very disturbing to the caregiver because they're struggling to take care of patients with the Parkinson's disease, and the psychosis makes it even more difficult. When we see a patient with Parkinson's disease psychosis, first of all, we make sure that they don't have delirium, no urinary tract infection, no pneumonia. Make sure that this is not a delirious hallucination. Next, we try to adjust our medications downward, because we know that Parkinson's medication can contribute to the likelihood of having psychosis, but that's very tricky because we don't want to make their Parkinsonism worse. At this point, in the current approval climate, we would then usually add quetiapine. That's the most common antipsychotic used. It's not approved by the FDA for approval in this circumstance. There's a black box warning against its use. So you try to use it very minimally, but you have to try to help your patient. In development is a drug called pimavanserin that has had a very positive phase 3 trial for psychosis in Parkinson's disease. It had excellent efficacy, it had excellent tolerability. It's going to the FDA, and we hope that it'll be approved and become available so we can take better care of our patients with Parkinson's disease and psychosis.